This is Nicole Jorwic, the Senior Director of Public Policy for the ARC of the United States. I'm glad to be giving you another update this week. And this week we actually have finally movement. I've been talking about Package 4 for what it seems like forever. And yesterday, on Tuesday, House Speaker Nancy Pelosi unveiled a more than $3 trillion coronavirus aid package. It provides nearly $1 trillion for states and $1 trillion for states and cities in hazard. It also includes hazard pay for essential workers and a new round of cash payments to individuals or the rebates. It is being called the HEROES Act. I want to be really clear that this is a very large bill. It is expected to be voted on in the House on Friday, and it is expected to be a party line vote. So it is expected to pass because in the House there are more Democrats than Republican. But Senate Majority Leader McConnell has indicated that the Senate does not see the urgency and won't act until at least after Memorial Day. And we are actually hearing even later, even July, I've heard, which is why we need to make sure that the Senate feels the urgency. The House bill that is expected to pass includes many provisions that the disability community has been pushing for. So I want to take a moment to say all of the pushing and all of the advocacy has worked. As far as what we got into the House package, but we need to really make sure that we're activating, not only so that the Senate understands the urgency, but so that the Senate leaves the parts that are really important in. So what was included that is helpful to the disability community? The first is including a global bump to the FMAP, or the federal match for states for their Medicaid program. This includes a 6.2 FMAP bump through June 30th, which aligns with what was passed as part of Package 2. And then at the start of the fiscal year, a 14% FMAP bump starting July 1st. FMAP bumps, what they do, I've talked about it before, but just as a little bit of a reminder, those are additional federal dollars that then flow into state governments to help them with their Medicaid programs broadly. So those are broadly Medicaid programs, but then we also got another FMAP bump specifically for home and community-based services. I've been talking about how we've been pushing for a grant program. So this is that same program. The mechanism is just different. The mechanism is an FMAP increase, a 10-point FMAP increase, which is quite a substantial FMAP increase and would be a huge chunk of federal dollars that would flow into states for home and community-based services. So this is in lieu of that grant program, but what it could pay for, what those dollars could be used for, are the same as what was in part of the grant program. It would be dedicated funding for home and community-based services. It would include funding for retention and recruitment of workforce, personal protective equipment, and just generally provision of HCBS to keep individuals out of congregate settings. The HCBS language around the FMAP includes supplementation language so that federal funds don't replace the funding that states have already allotted for HCBS. So these are additional federal funds. They're not meant to replace state dollars. To support nonprofits, the bill strengthens the payroll protection program that was passed as part of the third bill. And it also allows for larger nonprofits. Before nonprofits over 500 were not included, and now they are. It also includes a bill called the Standing Up for Small Businesses, Minority-Owned Businesses, and Nonprofits, a bill that requires the Federal Reserve to include nonprofits, including larger nonprofits, in a Main Street lending program. So this would be different than the PPP loans, but it would be a different type of loan that will provide that stopgap funding for service providers as we await the broader dedicated funding for home and community-based services. The bill also, the HEROES Act, expands the recovery rebate payments to adult dependents and issues another round of payments, including everyone this time. It includes language that would disregard unemployment payments from income and asset tests for means-tested programs, meaning that children with disabilities would not be kicked off of their benefits if their parents were getting UI, and people with disabilities on SSI would not lose that SSI because of unemployment. The paid leave provisions were expanded. That was another big ask that we had. And the paid leave provisions were expanded to the same level leave purposes as paid sick days, meaning that now siblings and grandparents are also included in the definition of a caregiver, and so that paid leave will also be covered. It includes a $850 million fund to provide child care for essential workers, essential personnel, and that does include DSPs. So it provides those funds so that DSPs can keep working and not have to worry about childcare for their own families. It has increases in SNAP benefits. It defines an essential worker to include direct support professionals so that there will be that access to the personal protective equipment that we've been discussing over the last several weeks. There is an additional $100 million to the Administration for Community Living, which includes $10 million to Developmental Disabilities Act partners, the PNAs and DD councils and USEDS. There also is a special enrollment period for the Affordable Care Act. A lot of individuals who have lost their healthcare coverage, so this would be open a new window so that individuals can have access to insurance. And there is additional $200 million for housing for people with disabilities, additional funding for education included in, which is obviously includes special education. So that was a large laundry list, and we were really excited when we read this 1,800-page bill that has a lot of this really good stuff in there. But the bill is large, and it's certainly going to get narrowed by the time it goes to the Senate. So the bill is going to pass the House, and then it's going to go to the Senate, and it's going to be negotiated. It's very important to reach out to your House members this week before Friday when they're expected to vote, specifically asking for the HCBS funding and to keep in the broader caregiver definition and the additional flexibilities around the rebate payments. And then it's going to be important to turn the attention to the senators starting this weekend to highlight the issues mentioned here so that they know that HCBS funding and all of these things need to stay in as they're negotiating the package. The Senate will go through their own negotiation process. Again, we're not sure of the timing. It's looking like it might go a month. And then whatever is negotiated will have to be voted on again in the House since it's not going to be the same version. But just know that we will be pushing here to make sure that these pieces stay in. And once again, I want to thank you for your advocacy before and your continued advocacy because it obviously works. The voices of the community have been heard in this draft legislation, and we need to make sure that they keep being heard as we move on to the next phase of negotiations. Thank you and be well.